that have already joined, I'd just like to say welcome. My name is Morne Christo. I'm the Dan Southern Africa CEO. And this evening, our guest speaker is Dr. Cecilia Roberts. She's one of our Dan diving doctors. And for those that know her, you might have spoken to her via the emergency hotline. And she'll be presenting the talk this evening. I'll give her a formal introduction in a little bit, but the Dan webinar sponsor, you've met her already. It's Amanda from Adventure Mania, and I'll allow her to jump in and talk a little bit more about all that stuff. But what Amanda and Jacques have done, they've been very kind to sponsor prizes again. So for the folks that have joined, please stick around until the end. It's what they refer to as the Adventure Mania goodie bag, and it includes a t-shirt, hand towel, and water bottle that's branded in Adventure Mania logos and things. So it really looks great. We'll share some of the images in a little bit. First of all, for those that have already joined, thank you for making the time. We know your time is valuable, and I'm sure you're looking forward to the talk. I believe that it's going to be very informative. First off, also, I'd like to just say I hope that you guys are all safe and healthy during these difficult times. And just a couple of basic house rules. You'll find that you are muted and that your video is turned off. That's just the webinar setting. So if you're looking for that function, you won't find it. If you'd like to introduce yourself and tell us where you're from, or even what your expectations are of the webinar, please use the chat box to do so. You'll also see there's a Q&A box, and that's obviously reserved for questions. So if you do have any questions, please use the Q&A box. And on the other hand, if you have any questions as the presentation starts, perhaps hang back a little bit, because you might find that some of your questions are answered as Cecilia continues with her discussion. So, but by all means, do make use of that. The webinar replay will be available via Facebook and YouTube, or at least the Dan Southern Africa Facebook and YouTube channels. And I'll also email it out to Dan members and people that registered. And for the folks via Facebook, if you'd like to get on that mailing list, just leave your email address in the comments box. And if you're not comfortable with that, just send me an email. You can use the following email address, and I'll pop it into the comments box. It's dansa@dansa.org. So I'll pop it in a moment. And then again, just a reminder, please stick around till the end of the webinar. That's when the lucky draw will take place, and Adventure Mania will obviously, we'll put you in touch with them tomorrow, so that you can start making the arrangements to get your, or the lucky draw winners can get their prizes. So yeah, for the folks via Facebook, I haven't checked yet. It's a bit busy with all the things, but I've already got a couple of messages in that the Facebook feed is working. Some folks have said that it's frozen a little bit. I think maybe just check your connection or refresh. You might find that the image and the video will start again. So let's meet Dr. Cecilia Roberts. Just a quick brief bio. Dr. Cecilia Roberts is a qualified diving and hyperbaric medicine physician. She's based near Cape Town with additional experience in emergency medicine, anesthesiology, and occupational health. And she has a passion for nature and enjoys outdoor sports such as hiking, mountain biking, trail running, and hang tight, without a doubt, scuba diving. So yeah. So just before we hand over to Cecilia, I'm going to hand you over to Amanda, as the sponsor for this webinar, to tell us a little bit more about Adventure Mania and what they do in Sudwana Bay. Over to you, Amanda.
Hi, everybody. Nice to have everybody with us tonight. Hopefully we'll have a few more people as well. We are based in Sudwana Bay in the northern KZN. I'm sure most people know where that is, but if you don't, I didn't know at least 15 years ago before I got here, I didn't actually know much about it. We are a dive concessionaire, licensed operator. We dive within the marine protected area. We take divers out, qualified divers. We teach new divers. We do instructor training, dive master training. We do red active diving. We teach red active instructors. We teach anybody with any physical disability or otherly, or what do you call it, differently abled bodies to scuba dive as well. We do free diving. We are in an amazing area where you could possibly teach just about anything besides cave. Cave we don't have, but we do have a 10-meter dive site, we have 15-meter dive sites, we have 40-meter dive sites. So it's just an amazing area, especially training and learning to dive and getting used to diving. It's an incredible training ground. We've had a lot of success with learners coming to dive, new learners, people wanting to further their dive education and become instructors and dive masters as well. It is really for everybody. Your nervous divers, your very experienced divers, everybody enjoys it on a day. And yeah, so the best news ever, we are open and you can come dive in. So we are super excited and we cannot wait to see everybody actually face to face, even with a mask on, that's okay. We have done, I mean, we've had a lot of Zoom meetings and we've kept in touch with a lot of people via emails and WhatsApp and whatnot, but oh, it's going to be good to see the actual person and the people in their wetsuits again and under the water. We can't wait. So yeah, that's what we do. We are fully open again. We are fully functional. We started diving again today with some diver clients and students. And yeah, the rest of the season is set for us. And with all our protocol in place and with everything set to what it's supposed to be, we will dive safe and we will be safe, and very excited about all that's happening. Even in the new, what I call the new year, because I feel COVID had its own year. It's now done. We are now in the new year. Yeah. Yeah, it's great that it's actually it's coming into summer, which is really awesome because the weather is getting better and the dives, the water temperature is getting better. So we get up to about 27, 28 as well. So super cool diving. And yeah, excited, guys. I just everybody just come and dive, and then we'll go to the other areas as well.
All right, great. So Mona has asked me to talk about the health considerations for women divers, and I think it's quite an interesting topic to discuss, as there are some interesting facts or some interesting considerations to keep in mind as a female diver, and for your female divers, especially for those instructing. The era of scuba diving being considered a male-dominated sport is long past. And women account these days for around 35 to about 40% of all recreational certifications. And worldwide, women are also employed in the recreational, scientific, commercial, and even the military diving operations. So it is quite a nice, new upcoming topic over the past years, and a lot of interest has grown in terms of the health considerations in women divers. So during the presentation, I'm going to look a little bit in the history of diving, women in diving, and we'll look at some of the gender differences between male and female divers. We'll also then discuss a few sort of women-specific or women-only topics, and lastly, just end up with a few recommendations for our female divers. All right, so looking at the history of women in diving, and this goes back to around about 2,000 years. And it all started with the shell divers in Asia. They're probably the oldest known divers, and they were both female and male divers. And about 400 to 500 years ago, this changed as the female divers became more pertinent. They exhibited a better tolerance to the cold water, and there was folklore so that diving causes affects male virility, and so that's why in the Asian shell divers, females became more predominant as the diving that do all the diving work. A second interesting group is the AMA of Korea and Japan, and the word AMA actually means women at sea. And they are also referred to as the pearl diving mermaids, and they are famous for their breath holding capacity and capabilities. They usually dive down to about 30 feet for about 2 minutes. And this they do for around 4 hours every day, see weeds, shells. They are also a very interesting group that has been studied by many interesting diving medicine researchers because of their ability to hold their breath. And it seems like they've adapted over the years as they increase their basal metabolic rate by 30% to conserve heat. And they, by increasing their body tissue insulation, they cause vasoconstriction, which decrease cutaneous blood flow, the blood flow to the skin, so they have less heat loss, and they also tend to develop over time a tolerance to shivering, which then gives them sort of this conservation of heat and being more resistant to cold water temperatures and the ability to tolerate these colder water temperatures. And then if we look at the more modern day divers, we remember and we all know about Simone Cousteau, the wife of Jacques Cousteau, who's a very, very well-known diving researcher. And she was probably one of the first well-known female divers to join her husband. And then later on, Lottie Haas also made name for herself with her expertise in diving and underwater photography. And this was despite the discouragement of her husband. And there's an interesting autobiography that she's actually written about herself. And then there's also Eugenie Clark, the shark lady. She has become well known because of all her research. And Sylvia Earle herself has also been very prominent in diving literature as being leading the first all-female team of aquanauts in the Tecti 2 habitat, where they did experiments underwater, and they stayed there for 2 weeks, and they were sort of praised by the press and everyone for being very professional in terms of their diving and scientific research. And then, interestingly enough, our first US Navy female diver was Katie Gardner. She was the first female scuba Navy diver, and then she was followed by Donna Tobias as the first deep sea diver. But perhaps the most important contribution of women in the diving community has been in the instructional area. And today we see that about 1 in 3 of our trainees entering into diving are female, and they make up about 40% in the end of the diving community. And female divers that go on to be instructors tend to be very good diving instructors. Don't want to say too much. We very fond of our male divers, but sometimes ego and bravado do get in the way, and women seem to be more attentive to questions and listening a little bit better, and sometimes that's why they feel or they are experienced as very good instructors. Not to say that men are not good dive instructors. And then they also go on to be tech divers, commercial divers, free divers, and also play a role in our photography, underwater photography, and scientific research. On the home ground, recently on the Dan blog, you would have read of quite a few pertinent female divers. Sandra Andreotti as the white shark researcher and conservationist, and she did a talk to you guys the other day. Lauren Offer is a wildlife presenter, zoologist and marine biologist. Beth Neal, a master in pure apnea and a freediving instructor. Jean Hutting, who is probably one of the best female spear fisher ladies. And then Shani or Charlie Warland, as she is known. And then women also don't stand back in terms of freediving competitions. And I thought this was just quite interesting, seeing the records as of December 2019 of the different disciplines in freediving, of the women and the men, and what all these disciplines are about. So moving on from a little bit of history of women in diving, let's look at the gender differences that we get between male and female divers. And although men and women divers have more in common than not, there are some anatomic and physiologic differences that can influence the diving hazard and risk. So, Amanda, are you ready to give a prize? Let's see. So Mona, if you can run a poll for us, compared to males, what do you think? Women generally have a higher percentage of body fat, a higher lean body mass, or a higher compressed air consumption?
Right, I've launched that poll. Let's see what everybody says. So just while they're completing the the quiz there, seems to be, again, some issues with Facebook, but I've relaunched it and it seems to be working fine again. So I do apologize for that. All right, let's see. We got about 76% of people that have voted. We'll give it another 3 or 4 more seconds, 80% before I close it, and then we can show the results there. I see Amanda laughing. All right. Okay, so I'm going to end it and I'll share those results. Cecilia, can you see the results on your end?
Yes, I can, Morné.
All right, so you can give them some feedback on that while I just share those results.
Okay, so the majority of you guys are 100% correct. And compared to males, women generally have a higher percentage of body fat. So let's see what that is about.
All right.
All right, so despite any fitness training, female or women divers usually possess a higher percentage of body fat versus their male counterparts. And a sedentary female around 25 years have normally about 25% body fat, whereas as a trained female would have between 10 and 15%, and trained male counterparts between 7 and 10%. Having said this, this also gives us a little bit of better insulation from heat loss, and also increases our buoyancy. And at the same time, we might have a little bit of less lean body mass. And the question comes as, because of that, do we then really tolerate cold better? And is the onset of hypothermia longer in females than in males? So having a greater percentage of body fat then also gives us a potential greater store for nitrogen uptake and retention after diving, which theoretically can increase females' risk of decompression illness versus their male counterparts. But having looked at numerous publications and research studies that has been done, the epidemiological statistics and articles are ambiguous, and it seems like diving behavior plays a bigger role in this, and that our male divers are a little bit more aggressive in terms of their diving and a little bit more brave, whereas women are a little more conservative. So, and then also we do have more male divers than we have more female divers, and more male diving members. So if we look at statistics, then it's likely that we're going to see more diving decompression incidents in males than in females. Interesting enough, in altitude decompression sickness, women seem to be more susceptible. So having decompression from altitude or in hyperbaric environment, and they usually have less more serious symptoms of decompression sickness for the same profiles as their male counterparts. Then looking further, we have less muscle mass in men. So it is more difficult for us to swim against strong currents, and we can tire more easily versus our male counterparts. We also might have a little bit more difficulty lifting and carrying equipment on land, but as I said, training plays a role here, and a fit, well-trained athletic female might be able to move more than an untrained and overweight man. We also decreased metabolic active tissue for heat generation, but vasoconstriction gives us an advantage to conserve more heat. We also have a smaller body size versus our male counterparts, which also houses smaller lungs. So we do take smaller breaths, and that's why we conserve air a little bit better, and why we can usually, if we're not too anxious and don't breathe too fast, we can usually dive longer on the same cylinder or amount of air than our male counterparts. And then for our body shape that differs from men, we need to have specially, it's much nicer for us to dive with specially adapted equipment. And furthermore, we are able to efficiently conserve energy due to our lower basal metabolic rate and having less sweat glands and less heat loss. All right. So that was the anatomical differences we looked at. Looking at a bit of physiological differences between males and females, we have a lower threshold peak sports performance. So we're slower and we have less speed, and also maybe a little bit of decreased capacity and stamina. In terms of our thermal balance, although we have better viprine in terms of our increased body fat percentage, we also have better peripheral vasoconstriction, which can buy us a little bit of time, but we are less quickly to adapt to cold exposure. And the effect of the physiological differences in the end are actually minor. And on entering diving initially, although we are unable to match performance, we can adapt with training. And one interesting thing with women is that during the hormonal phases, we are likely to retain more fluid or have more tissue retention of fluid, which can then cause more diving related or increase our risk for having dive relating ear or sinus issues. Lastly, looking at a bit of psychological differences, mostly women are extremely safe divers. We dive efficiently, intelligently, and well, take few risks, and very considerate dive buddies in general. And the differences between male and female divers are less pronounced in terms of diving risk-taking and diving depth, are less pronounced in the younger divers versus the more mature women divers. But we also have a group of female divers that are more fragile divers, and they insist on their male counterparts to do everything for them. They sometimes forget over time how to check everything themselves, their gear, how to do everything. And if a problem then arises, they are at increased risk of having diving accidents or incidents, and which has a role to play in the liability and being incompetent in case of acute emergency. Another psychological influence we see from a female side is when we have menstrual stress or premenstrual stress. This can cause some moodiness and anxiety, fluid retention, cramps, abdominal pains, and sometimes it may contribute to increased risk for diving incidents or accidents. But there's no statistical evidence that more diving incidents or accidents actually happen during our menstrual phase. If we actually look at accident statistics, the data would seem, when you look at this latest published graph of the distribution of age and sex fatalities for the United States and Canadian scuba diving fatalities in 2015, that there are more male fatalities versus female divers fatalities. But like I said earlier, this can be due to the underrepresentation in membership and also the dive-sex ratio of having more male divers than female divers. One interesting statistic though is that we tend to see more breath hold incidents in our male divers versus our female divers. All right, so let's look at a few female-specific topics in diving. And before we start with those, let's run another poll again. So,
all right, so I've launched the poll there. We'll give the participants, you know, a bit of time just to complete that, see what they have to say. While that's taking place, I see some of the folks have been asking a couple of questions. Cecilia, while they're answering, I might just run through some of them. Russell Upland, he wants to know, how can we get more women and girls involved in diving, and how can we make diving more female friendly? So I think we will answer that in a bit. Then Naomi and Carl van der Kolf, they want to know why with higher percentage body fat will women get colder? And then the last question we'll get to is Russell wants to know again, what are hormonal phases? So once we're done with this, maybe we can look at those before you continue, Cecilia. So I'm going to end the poll now. Most folks have answered. I'll end it. So yeah, it seems like, if I remember correctly, pregnancy is the correct answer. Is that correct, Cecilia? Oh dear. Seems like we have lost.
There we go. Sorry, I just muted myself. Yes, Monet, correct. About 77% of our participants also know that diving is contraindicated during pregnancy.
Okay.
And we'll get to that in a while.
All right, fantastic. So I'll stop sharing that. Shall we continue, and then we answer the questions at the end of the webinar? Is that fine with you, Cecilia and Amanda?
That's perfect, Monet.
All right, cool.
All right. So let's look at menstruation in diving and how it affects us. So the question was about what do we mean with hormonal cycles. And when we talk about hormonal cycles, we actually talk about the menstrual cycle in females. So menstruation is basically a hormonally controlled cyclic discharge that a woman has, a bloody discharge every 4 weeks. And around this time, usually they lose about 50 to 150 mils of blood over a period of around 3 to 5 days. Some women can have very heavy menstrual periods, and they might lose around 200 to 300 mils of blood during this period. Now, there's always been an interesting hypothesis that if women dive during their menstruation, would they attract sharks? And luckily, there's no evidence for this belief. And actually, it's been found that female divers experience a lower incidence of shark attacks. And the hypothesis is that the hemolyzed blood can act as a shark deterrent. Mostly during the menstrual period, this is usually the effects that women feel or the symptoms they experience can be negligible, and they usually cause minimal interruption. But for some females, they can suffer very bad premenstrual symptoms or menstrual symptoms, and some have very heavy menstruation, some have severe abdominal pain, they can have irritability, nausea, vomiting. And usually we advise that if they need medication, that it's better for them not to dive. Some are also prone to get migraine during their cycle, and this is usually premenstrual. And then we usually advise them to avoid triggers for this migraine, which is usually the triggers that we see in the diving environment. So the cold, oxygen breathing, CO2 retention, even venous gas bubbles that we form during diving can trigger a migraine attack. So when you're premenstrual, you can then actually increase your risk even more to have a migraine attack. What we also see is that during this time, we do get fluid retention in females, and this tends to cause congestion of their mucous membranes. And this can cause difficulty in equalizing in some ladies, which then immediately increases their, or can then increase their risk for barotrauma of the ears if they aren't able to equalize because of that fluid retention, or sinus barotrauma even. So talking about decompression risk during menstruation, because that's also a topic that has been widely discussed, and some research has been done trying to get more and better information regarding this. And there's some studies that have shown that it may be increased during the first week or the early phase of the menstruation. In other words, the day from start of menstruation, the first few days or the first week. And that it also, that oral contraceptives and taking oral contraceptives can also further increase your risk. And it's then advised to reduce your dive exposure during this time. And we're going to touch on that in the next few slides. But basically, in terms of recommendations on whether women should dive during their menstruation, it's really depends on how she feels. If she has very low premenstrual symptoms or very few symptoms, she keeps well hydrated, she doesn't have trouble equalizing, then it's usually safe for a female to continue diving during the menstrual period. Right. Let's look a little bit at this slide, and it's very busy and it's just for interest, but this was basically research that was done by Lee, looking with a questionnaire study. They sent it to a few women, got about 150 analyzable questionnaires returned, and the females that filled in this questionnaire sort of represented the average female dive population in the UK. And what it showed was that there was a higher incidence of decompression sickness during the first week of menstruation on those that were not on oral contraceptives. And you can see that in the, this is the darker of the two bars. And so there was a higher percentage of women with decompression illness in the first week. Interesting enough, for those women that were using oral contraceptives, it seemed that later on in the cycle, during week 3 and week 4, this would have the risk for decompression sickness increased. And this was compared to numbers seen in an older study that was done in women in altitude chambers at the the US Aviation Center, and they also seem to find that for those women that were menstruating, or for the incidence of decompression illness were higher in the first week of women in their menstrual period, in those cases that they diagnosed. But the research is quite divided about this, and our advice in terms of this usually is that women should just follow more stricter and dive within the no-deco limits during this period, or if they're on oral contraceptives and menstruating, and be cautious. So if they're not on oral contraceptives, the first week or the week of menstruation, to be careful of their dive profiles and dive within the no-deco limits, hydrate well. And for those that are on oral contraceptives, to be on to do that just in the week or two before they start menstruating. So let's look a bit at oral contraceptives just for interest. They're basically a combination of estrogen and progestins. So, and they try to mimic the female menstrual cycle, but what they actually do is to try and prevent a rise in luteinizing hormone to prevent ovulation, so that the woman can't fall pregnant. Other side effects, they can cause side effects like fluid retention as well, and weight gain initially, which then subsides. But luckily these days with the newer, younger and oral contraceptives, the side effects are much less. So they've realized that a lot less estrogens are needed, a lot less progestins are needed to control the cycle. It's a very sensitive balance, and there's quite a lot of literature out on that as well. So the one thing that we need to remember about oral contraceptives is that there can be a slight increase in risk of deep vein thrombosis or blood clots that can form, and this is usually in those that smoke together with taking oral contraceptives or have a history of underlying clotting disorder or blood clotting disorder. But it is much less with the newer low-dose drugs. And usually, obviously, if you take your oral contraceptive and you take into consideration the diving environment, we also need to take into consideration the risk of falling pregnant. So there's no evidence that oral contraceptives alter the risk for decompression illness, and the risk of falling pregnant is greater. And therefore, we would still advise that you continue taking your oral contraceptive, but that you, if you smoke, that you stop smoking, that you do be vigilant or are vigilant of a family history of blood clotting disorders, and that you do take the lowest dose possible to control your cycle. There are other contraceptives as well, patches, the ring, spermicides, barrier creams, the depot injections or implants, and IUDs, and all these are safe to use during diving. So coming back to the talks about decompression sickness and just a bit of sort of recapping everything and doing a bit of recommendation. So it was initially thought, or there's a common perception that females have an increased susceptibility due to their increased body fat percentage. But the studies are conflicting. And actually in the end, it's our individual and our environmental factors that play a role in terms of our risk of developing decompression illness. And we actually do see a high rate of decompression sickness in males versus our females, and this is mostly due to them following more aggressive dive profiles. There's no good data that supports or suggests that we are at increased risk of decompression when diving on air within our recreational dive limits. And but what we do see that when women get decompression sickness, that they actually we do tend to see a higher rate of type 2 decompression sickness in women versus men. Women may be at risk to develop decompression sickness from altitude decompression. There we know our risk is a little bit greater. And we can also exhibit lower incidence of bubbles, but with the similar decompression sickness rate. In other words, that we can have a smaller bubble load during altitude decompression, but have similar rate of decompression illness incidence versus male counterparts. And then these also, in terms of altitude decompression sickness, seem to be clustered during the first week of a cycle, according to the research study what was done. So although there is no clear evidence for oral contraceptive use and menstrual period, the hypotheses around these, like I said, we do advise women to err on the safe side. The last 2 weeks of their cycle, they might be more susceptible and to dive over no deco limits, and that so they keep safe. There's no evidence of any difference in pulmonary barrier trauma or arterial gas embolism in males versus females and decompression sickness wise, and the PFO incidence between males and females seem to be equal as well. And then it's also just important to note that both no-stop diving decompression sickness and altitude decompression sickness are actually rare events with the incidence of between 0.1 and 0.5%. So, having said all of that, this is pretty much after reading all the literature and trying to say and trying to conclude everything in the last slide. When you go through all the literature and research, this is sometimes what you feel like. A wise man to his son said, "My boy, when you accumulate the understanding to know why a pizza is made round, to be put in a square box, and is eaten in triangles, then, my son, you will be able to understand women." So let's have a look at breast cancer, cancer and surgery in women. So we know that about 1 in 9 females can be affected by breast cancer, and the treatment of breast cancer usually includes surgery and can include chemotherapy or radiotherapy. During the treatment, the potential for side effects is the greatest, and they can suffer unpleasant side effects like nausea, vomiting, lack of energy, and even side effects from the chemotherapy like immunosuppression, diarrhea, and fatigue. What we therefore recommend is that they avoid diving during cancer therapy, and also some of the chemotherapy drugs or even radiation can cause pulmonary fibrosis or pulmonary toxicity. And this can then, especially pulmonary fibrosis, can make them more susceptible to pulmonary barotrauma. So we usually advise diving medical after treatment, prior to resuming diving, just to make sure that strength and general fitness has returned and everything is back to normal, and that they are healthy and fit to return to diving and are not going to have any risks in the water. The one thing also to remember is that you might need to make adjustments for buoyancy and gear, depending on whether they've had mastectomies.
Celia, I don't know if you can hear me, but it sounds like your sound's gone, is off.
Can you hear me?
Okay.
Can you hear me?
Sorry about that.
No? Can you hear me? Okay. All right. So, it's just a reminder to correct for buoyancy, and gear might need adjustment depending on what surgery they've had and whether they've had reconstruction or implants, and also to allow for complete healing of any operation areas before they return to the water. In terms of ovarian surgery, ovarian tumor removal, they get removed, surgically removed, and they might have to undergo radiation. And we usually allow a 6-week post period after surgery for healing before they can return to diving. So the issue is mainly with the treatment that women get during these happenings, and not the cancer itself. And usually it's around 6 to 12 month period after successful treatment that they can return to diving without any hassles. So just remember that early detection is key, and that self-examination is important, and to go for your annual mammograms when you're older than 40, especially if you have a family history of breast cancer. All right, before we talk about mammary implants and how diving affects them, let's run another poll.
Okay, just give me a second to launch that, Cecilia. There we
okay,
go.
Well, Mona is launching. So how long after mammary implants can a woman return to diving? So 4 weeks, 6 weeks, 12 weeks?
Right, interesting. Okay, we'll give it another 5 odd seconds. We've got about 80% of the attendees that have voted already. And I'm counting down 3, 2, 1. This time we're not going, but we're stopping. So let me end the poll. Cecilia, I think you can see there, ooh, I think as far as I remember, it's 12 weeks. Is that correct?
Actually, you are able to go back diving 6 weeks after your implants.
Okay, 6 weeks. Okay.
Everything is uncomplicated and your wounds have healed well.
Okay.
So,
all right. So there are the results. I'll stop sharing. So it was sort of a mixed batch between 6 and 12 weeks.
Sorry, Mona, you're right. It's me that answered it incorrectly on your sheet.
Anyways, I think the attendees
on the slide.
are on the mark there. Yeah. All right.
Okay.
Great.
So, interesting looking things, mammary implants, when they're not in the breast tissue. And they can compromise of saline or silicone gel. They can absorb some inert gas, and silicone implants can actually produce decompression bubbles after a normal recreational dive profile. But that's a study that was done in a chamber. And we can see up to a 4% increase in size has been seen after diving. But it's not considered to be harmful and nor usually negative effect by the diver or their partner. And there was a study done by Richard Van and his company, and that they picked up there was the minimum volume change after the dive, but should you then immediately go flying after diving, then there can quite be some bubble formation in the implants and they can grow in size. Damage is unlikely and it will resolve over time. So we usually allow a 6-week period after breast implants for recovery and for the wounds to heal. Important things to remember after or when you return to diving is to avoid any restriction over the implants. So make sure your buoyancy compensator fit correctly or your wetsuit fits comfortable. And then also that you might need to adjust your buoyancy and your weights. So saline implants are usually neutrally buoyant, but silicone gel implants are heavier, and so you might need to adjust your buoyancy. They're negatively buoyant. So you will have to adjust for them. And they won't burst. You don't have to worry about that. There's no contraindication to continue diving after implants, and it shouldn't pose any risk to you at all. Now let's look at pregnancy. Pregnancy is also usually a hot topic, especially being discussed by younger female divers. Most female divers of childbearing age may fall pregnant sometime in their life. And the 9-month layoff is not always appreciated by all, especially not the enthusiastic diver, and it can even be disruptive for the working diver. So research on this topic is very limited, obviously because of ethical reasons, and it also seems to be inconsistent. So to give clear conclusions in terms of what's been found during research is difficult. And there's been numerous case reports, retrospective diver surveys and studies, animal studies especially. And although there's no solid proof or data that, in terms of research-specific scientific data that diving is dangerous to the fetus, our belief is that the risk to the fetus is much greater than the risks to the mother. And that is especially in the first trimester during organ formation, and which can then, if the mom dives during the first trimester, can lead to birth defects or developmental problems. And in the third trimester, or the last part of the pregnancy, can affect the growth of the fetus. And there's also a concern with decompression illness or gas bubbles to the fetus during this period. So what we see in terms of risk of diving in pregnancy for the moms, We know that they usually suffer morning sickness, so most of the times they're nauseous and they're vomiting at times, which can cause dehydration, and obviously dehydration can increase your risk for decompression sickness. They also have a reduced ventilatory capacity due to the increased abdominal size, which affects their breathing. It also affects their peripheral circulation as we get fluid retention and differences in our cardiovascular adaptations during pregnancy. And we also see that females have a reduced exercise capacity during their pregnancy. Diving equipment can also not fit nicely if you're pregnant, and with everything changing in your body, and I'm sure a few of you would have noticed that and realized that if you have tried to put your gear on ever, and just feel how it feels during your pregnancy. And then one risk is also that because of the fluid retention, and like we mentioned earlier, the same risk as we can see during menstruation and fluid retention is that they can affect the mucous membranes, can affect the equalizing, so they might run the risk of barotrauma. On the fetal side, the high nitrogen load and even changes in oxygenation. So if the fetus needs a very constant oxygen partial pressure. So changes and fluctuations in oxygenation, but also nitrogen uptake and higher nitrogen load can cause teratogenic effects or problems in fetal development and birth defects. We can even see venous blood gas bubbles or embolization of the fetal circulation, which can affect their development. And then we also see that the mom undergoes, or whenever we are exposed to higher partial pressures of oxygen, it causes vasoconstriction, and that can also then decrease blood flow to the placenta, to the fetus. And then hypoxia is a risk during shallow water blackout. And all these fluctuations in oxygenation can be a risk to the fetus. Obviously, the risk to the fetus increases if the mother has decompression sickness and then requires a recompression therapy, because then we know they need to get 100% oxygen in a hyperbaric chamber. So a very high partial pressure of oxygen is delivered to the tissues, to the placenta, to the fetus, and there are effects to the fetus's eyes and their development, and that can happen if this is necessary. What we usually, or in data that has been extrapolated from studies, we see, and mostly animal studies, but we see low birth weight babies, so smaller babies do see some birth defects. Yeah, and when we think about free diving, we're not so sure how deep is allowed. Sometimes we think free diving is okay, but if we look at research done in the ALMA divers, so the pearl divers, they actually have a 46% incidence of premature infants or premature babies. So babies born earlier, but also they do, like I said, 4 hours diving daily to depths of 30 feet for 2 minutes each time. So it's just something to keep in mind. Snorkeling is safe during pregnancy. So our advice and the advice of most dive organizations is to avoid diving while you're pregnant because of the increased risk to the possible increased risk to the fetus, although the effects may be small. And also just one thing to remember is that inadvertent dive exposure does not give you the grounds to terminate the pregnancy. So if you have been diving without knowing that you're pregnant in the first trimester, there's no reason for you to terminate your pregnancy unless obviously there are any birth defects that has been diagnosed with sonograph, and then obviously it's also a decision that's not likely made. So let's look a little bit at the postpartum period, or the period after delivery. And usually the question here is around breastfeeding. So do we need to stop breastfeeding, or do we need when we dive, or do we stop diving when we breastfeed? No, none of the above. we actually can continue breastfeeding our baby and return to dive. There's no trouble or no contraindication whatsoever to breastfeed. Obviously, you can't breastfeed and dive at the same time, but yeah, breastfeeding is totally safe during or to continue diving if you're breastfeeding. There's no any issue with nitrogen uptake or delivery to the baby through the breast milk. Just some advice on making sure that the skin is clean and that you've cleaned nicely before you breastfeed, if you've dived before you need to breastfeed. There is some considerations that with diving you might get some dehydration, and that might affect your milk production. So we just give advice that you must make sure that you hydrate adequately. When can you return to diving after giving birth? So the general recommendation is that women can usually return to the activities about 1 to 3 weeks after delivery. And for diving, the global recommendation is about 4 weeks to wait for healing and for everything to return to normal. You can usually resume light activity within the first 1 to 3 weeks, and then return to your dive work, or if you want to go on a holiday 4 weeks after delivery. In terms of having had a cesarean section, the advice is usually not to dive for about 8 weeks until the wound is healed and everything is settled. This is also to give the internal tissues time to heal. You are going to be carrying heavy dive gear when you return to diving, and obviously we need to give the uterus and the muscle tissue time to heal up properly. Obviously, if there are any complications during the birth or the delivery or the cesarean section, this can affect the time for you to return diving, and must be kept in mind. So, and if there has been complications that may impact your diving fitness, we advise a medical screening and clearance before you return to dive. In terms of women that suffer miscarriage, if it's an early, complete miscarriage, they're likely, so within the first 6 weeks of the pregnancy, then they may resume diving after a week. If the miscarriage is later, so longer than 6 to 8 weeks, then a lot of times they might need surgical intervention just to make sure that there's no retained products. And we usually recommend a period of 6 weeks before they resume diving. Let's look a little bit at our older female dive population things that can affect them. So in menopause, do we need to stop diving? Certainly not. This is actually the period where you usually start to have time to dive, and that you can actually enjoy your diving a lot more. There's less things to worry about, hopefully. But things to keep in mind is that in the menopausal period, which the onset is usually around the age of 50 years, but it can be earlier, it can also be later in some. We might see osteoporosis or increased risk for osteoporosis, and this is due to the increase of the osteoclast activity, which results in some of your bone being resorbed and getting demineralized. And the overall lifetime of your bone mass actually is lower than in men, and you can lose that earlier, also because our estrogen levels drop when we go into menopause. And this then greatly accelerates that bone demineralization. So what we then see is that we get decalcification of bone, and that actually weakens our bones. They get brittle, and it can predispose us to bone injury, even after minor trauma or to fractures. One thing to remember is also that the older you get, the more fragile your skin gets. So you might bruise or bleed easier. One more reason that important to look after yourself, follow a healthy diet, and try to refrain or stop smoking, which also actually has a very big influence on skin health. You can take calcium supplements and vitamins. They're not contraindicated or cause any problems in diving. Hormonal replacement therapy is also a very good option in females, started at the right age and also at the lowest and shortest possible dose for symptom control for the time period. In terms of women or returning to dive after having had a hysterectomy, and these days hysterectomies are done in very different, or a few different manners. They can be done abdominally by open incision, they can be done vaginally, they can be done laparoscopically. And for all of the time, it doesn't matter really on the type of hysterectomy that you undergo. Usually ask that you allow a period of 6 to 8 weeks for recovery. Make sure that the wounds has healed up, that you have regained your strength and stamina, and then it should be safe for you to continue back to diving. All right, and then just a reminder that unfortunately, all of us are going to grow older, and with age, some medical concerns do creep up. So we start to think about high blood pressure, we think about cardiovascular problems, cholesterol, a lot of things that our risk for certain things does increase with age. And therefore, we recommend that you do go for medical checks when you are older than the age of 50. Okay. So to summarize and sort of get everything in a nutshell, what's been said, and a few take-home messages for tonight. What recommendations can we give from this and from what we know? So in diving, it's always important to remember to plan your dives and use safe diving techniques. Avoid conditions that require sustained maximal aerobic endurance and avoid excessive bubble loading. Dive within your physical, qualification and experience limitations. Remember to make sure that your dive equipment fits well, that you use correctly fitting and the best possible workable dive equipment that you can afford. And when you're menstruating, especially if you're taking oral contraceptive, do be cautious about your deco limits and and avoid pushing your limits. If you're on oral contraceptive, it's also important to ensure that your calf muscles are not compressed. And that so when in between dives, stretch your legs, sit or lie with your legs not crossed, stretched out, and ensure that your calves move if you're going to be sedentary for a while, especially on a flight or anything like that. Pregnant women should not be diving, but remember that inadvertent dive exposure is not grounds for pregnancy termination. And yeah, we advise a periodical medical exam if you're over than 50 years of age. So thank you very much for your time, your attention. I hope this has been informative. And yeah, if there's any questions or anything that you would like to discuss, Mornay, over to you.
All right. So, Cecilia, thank you very much. Loads of things to consider. I'd like to know if you scroll over your screen, if you can see the Q&A box. It might be easier for you to, I think you'll have to stop sharing first, and then you can have a look at the Q&A side of things. But maybe one of the first questions that was asked by Russell Opland is, how can we obviously get more women and girls involved in diving? Now, I guess one of the ways could be to have more webinars like this, expose some of the women that have done great things in diving and use them to promote the sport. I know that we've done quite a bit women in diving articles over the last couple of weeks and so forth, but I don't know, Amanda, maybe you've got something to add there. You just need to unmute yourself. Ah, there we go. Ooh, sorry. Amanda, sorry, you still muted? Ah, there we go.
Yes, start again.
Yeah, cool.
I think, you know, the awareness has been created a lot more lately. We have had a lot of events, a lot of programs run based on, you know, female divers, female from young to sort of your students, and then some of the older women as well. I think it is important to just put it out there that it is something that anybody can do. It is definitely something that is fun to do, and we just need to welcome the woman into this environment and welcome more diving women groups, even not to exclude the men at all. I mean, but somebody needs to carry the very heavy things, see, but it is something that women that need to know that it is very possible to do. It's not hard labor. And you can get help doing it if it's something that's too heavy or whatnot. But it is actually pretty easy to learn once you've braved it. And women are good at diving. They really are. Once they've braved it and they've got into that water, they're amazing divers. They're so relaxed and so chilled. And I mean, I've always found, and it doesn't take away from any of the male good divers, that women are just amazing under the water once they've embraced that and they've braved it. So we just got to put it out there more and promote it more. But it has been happening quite a lot lately. So we just keep pushing on that one.
Yeah. Yeah, I think keep those, you know, exposing women in diving and make it sort of accessible. Cecilia, can you see the questions on your end, or would you like me to read them out to you? If you click on that Q&A little box, you might see them.
I can see them, Mornay.
Okay, so I think the first one there is from Naomi and Carl.
Yes, Naomi and Carl van der Korf, hi. You asked why, with a higher body fat percentage, will women get colder? Basically, because of the increased conductive heat losses, as women have a slightly higher surface area to volume ratio, and we have less or smaller muscle mass. So we actually have less metabolic tissue, active tissue to generate heat, and then that higher surface area volume ratio.
All right, great stuff. There was another question just below that from Russell Opland. Can you see that one?
Yeah, the hormonal phases, I think we've covered that in the basically when we talk about hormonal phases, so menstrual phase, the luteal phase, and then when estrogen and when your progestins work in terms of your menstrual cycle.
Okay. I see there's one from Charles Marais about free diving. So for those that can't see it, Charles asking, in free diving, there's a belief that females have a higher lung RV residual volume percentage wise to male. Considering that females are in general more supple than males, is this true? So that they've got a larger lung capacity?
Yes. So the lungs are more compliant. I think, I'm not sure if that's what he's asking or means. Yeah, if your lungs are more compliant, then your residual volume might actually be less. But yeah, it's an interesting question. I'm not sure what the clear answer is to that. We'll have to look into that. Yeah, and saying that females are generally more supple than males, I think likely, but debatable.
Okay. All right. So let me see another one from Russell Opland. Were the findings in the OCP studies statistical significant?
No, they were for that one study, yes.
Okay. Let me just see here, allow anonymous questions, okay. Russ, I can see you asking me to expose the questions. I'm just trying to figure out that setting there, but in the meantime, I'll continue. There was another question from Russell Upland. Any studies or data on the influence on OCPs or hormonal cycles on tissue compartments? Are women more or less likely to on-gas or off-gas quicker or slower due to OCPs or hormonal cycles? Sure, that's a big question.
Yes, so I can actually share the paper. That's a very good question, and it seems like you are very interested in that. So if you want, I can share that paper with you, which actually has all that information that you ask about in there, a lot of it. But basically, it has a lot to do with our fluid balances and fluid shifts during our menstrual cycle, and that actually then increases the possibility of nitrogen uptake and retention. So I think I had it in the one slide. Might not have actually mentioned it. But
so says, if you can share that paper with him, that would be great. And I've got his details, so I can pass that on to him.
Perfect.
All right, so we have another question. Says, I have a hereditary blood clotting disorder. Can you speak a bit about diving on blood thinners and lowering my risk of developing a blood clot? I'm not currently taking any OC.
Okay, thank you for that question. I'm not sure whether you are on a blood thinner or not, but yes, you can dive on blood thinners. Having said that, it's within guidelines or a protocol specifically for what you are on. But you are able to dive on blood thinning medication, depending on what it is. And in terms of lowering your risk for blood clots, so that is to hydrate well before, during, and after diving. Ensure that you move about and you're not sedentary. And yeah, and obviously if you don't have a known blood clot disorder, know what it is, and it's not a contraindication to diving at all. Like I said, there are treatment, and we just need to discuss the treatment specifically for you and work around that.
So what I'll do is, Melanie, I've also got some great blogs as well as little 5-minute factoid videos that we've created specifically on this topic, which I'll share with you. If anybody else wants access to that, please let me know. Then we've got Louis Engelbrecht, quite a long question here. Let me see. He says, hi, this is Louis Engelbrecht here. How's it, Louis? I'm a male, so I don't know if Dr. Cecilia will answer my question. I'm sure she will. It is also applicable to ladies. I have, that's a big word there, keratoconus, all right. What's it, an eye disorder. I dive with piggyback soft and hard lenses on the right eye. The hard lens often slips whilst diving, physically locating itself in between the eyeball and the bottom eyelid, or even pops out of the eye and sits inside the mask, causing me to end the dive. Any suggestions on that? Sure, okay.
Yo, Louis, don't you want to get a prescription dive glasses?
There we go. All right. Well, if it's
it is difficult, and with the hard contact lenses, it is going to be a problem because you are going to get gas bubbles forming below the lens, the eyes get dry in the mask sometimes, so it is making it difficult. So yes, using a viscous, very sort of eye drop that's not your normal thin eye drop, but the thicker one can help a little bit before you put your mask on. so that there's a better sort of seal of the lens over your eye. But I would also suggest looking into having prescription diving goggles made.
All right, so we have another question from Russell. If a woman is trying to get pregnant, is that relative or absolute contraindication to diving?
I would say relative, and most of the literature points to relative. It's not an absolute contraindication to stop diving. If you're trying to fall pregnant, it is advised. But if you know of the risks and you are cautious, then obviously I'm sure you will notice when there's changes, and then refrain from diving. Okay.
So another free diving question from Shalma Ray. During pregnancy, the dive reflex or free diving, what is the consequence due to vasoconstriction or surplus of blood due to the placenta being central, or restricted due to that being part of the chest cavity blood shift? So that's quite I know where he's coming from with that.
Sure.
I don't know if it's easy enough to answer that in a brief answer.
Yeah, that is quite actually a big discussion. So you get a lot of central pooling of blood during diving and immersion in water. If you're pregnant, depending on where you are in your pregnancy, also that presses on the return of blood to, depending on what position you're in, to the heart. The vasoconstrictors effects of immersion, the wetsuit, cold water, also has an effect on the workload. So there's basically a massive workload on the heart during diving and being pregnant diving and the diving environment. In terms of blood flow to the fetus and the placenta from there, that's a very big topic in terms of the effects that it can have.
So what I would suggest, if there are any sort of questions that weren't answered in full, I'll type the email address you can use just to get in touch with Cecilia and the rest of the DAN team, that we can provide a more complete answer if you require more than what's given now. I've got another question here. This one is from Gail. She wants to know, are you at a higher risk of skin DCS if you are overweight?
No, not necessarily, no.
Okay.
There's no evidence that points towards that.
Okay. All right. Another question from Russell. Any correlation between hormonal fluctuations and bubble seeding formation? Sorry.
It's all in that paper I'm going to send you. They talk about that's actually where the question comes in, of the effect of oral contraceptives and the influence of the different hormonal compositions of the oral contraceptives and the different phases of the hormones, your estrogenic phase versus your progestinic phase. It's interesting. There's actually they did a study looking at PFO in female divers and picking up PFO during the cycle, and it seems like there's actually an increased detection rate of PFOs if you're peri-ovulatory, so in other words around day 15. So they screened women and they did a transcranial Doppler, so they monitored for gas bubbles via the forehead blood supply, and they did it on day 1 and then day 15, and 25% of the 40 women, so 10 of the women had it, and they actually picked up 6 of them only on day 15. So so there's very interesting changes, and it seems to be that estrogen is a systemic vasodilator, and it's a very complex mechanism, and that there's also a role to play for fluid and sodium retention, which then causes relaxation of the PFO, which then causes bubbles to shunt.
Okay. So I can see Russ is going to really enjoy this paper you're going to share with him, because he's just, and he said very interesting results. Thank you. So Russ, I'll make sure that you receive that paper. And I mean, if you're happy that we can share it, I'll make it available via a link on the Dan website and add it into the email I'll send tomorrow. You must just let me know, Cecilia, if that's fine. Russ has another question. Any issues with other kinds of contraceptives, non-oral? And I think you might have answered that during the slide not, okay? So no is the answer, okay? All right, here's another question. It's from Kari. I hope this is not a silly question. Absolutely not. What is excessive bubble loading? She'd like to know.
No, absolutely not, Corey. It's not a silly question. So all of us form venous gas bubbles when we dive due to nitrogen uptake. And excessive bubble loading will mean when we take up more nitrogen than our body can process, or than when we ascend to the surface too fast and we get a higher bubble release, so we get more nitrogen released from the tissues than our tissues can actually handle. So our lungs actually act as a pulmonary filter for venous gas bubbles. And when we stretch that filter too far, so when we have a higher or excessive bubble load, then the lungs cannot handle that bubble load and filter it. So then we can get decompression sickness, and that's when we talk about an excessive bubble load.
All right. So here's just a question from Amishan Naidu. He's asking me about Dan membership that he signed up. I'll get back to you just so that you know I'm not neglecting your question. Madni Stradom, I found that scuba diving is great for decreasing cellulite. What is the biological reason for this? Okay. All right. That's a great question, I must say. Wow.
Mania, that's a brilliant question.
Yeah.
I'm going diving tomorrow.
Okay. Well,
I'm not sure, but I think we should bottle that.
Okay.
I think you can make lots.
Okay.
I'm not sure how much you're kicking or finning when you're diving. Maybe that can play a role.
All right. So maybe this answers Russ's question right in the beginning. How do we get more women in diving? I mean, there's a nice way of using it as a way of dieting and getting into shape and so forth, you know. But anyways, I don't know, is there any studies done on things like that, or is it just, it's not possible, or it is possible?
You're talking about the cellulite?
Yes, yeah.
I haven't seen anything published around that.
Okay, all right. So here's a question from Anonymous. What about using what's it?
Depression medication.
Depression medication while diving, yes.
So there's, it's not a contraindication to diving in most cases. There's certain antidepressants that are better in the diving environment and that do better. Or that we do better on, and that has got less effects in the diving environment, and that we prefer divers to be on if they need to be on an antidepressant.
Okay.
So yeah, so it's not a total contraindication or an absolute contraindication. We just need to see what exactly you're on and see whether it's compatible.
I remember Dr. Cronje once did a talk on this specific topic, and he was saying as some of the medications and the studies came and became more advanced, or people knew more about it, is that I guess in the past it was a no-no, but nowadays it's, you know, you look at the conditions and things like that, and quite often going diving helps the depressed state and so forth. So as long as it's controlled and well looked at, then it's fine. So another question from Russell, presumably he says technical diving or rebreathers in brackets, or possibly nitrox diving with a higher partial pressure of oxygen would increase the risks in the case of possible or actual pregnancy. Feedback on that, thanks.
Yes, Russell, that's actually correct. It's because of the hyperoxia, or the higher partial pressure of oxygen, especially on nitrox, as well as rebreathers that we can see, and that obviously with depth, and in the fetal development, as well as especially we do see in medicine, we even see from oxygen administration to premature babies that they get issues from too high oxygen pressures.
Okay. Here's an interesting question. Is the statement correct that one should never swim faster than your bubbles? I think that's definitely correct. And we want to take it nice and easy, take it slow, and not swim past our bubbles. And then Conrad, I assume this is a funny question, but who is the guy, Dan? Well, I'll leave that up to your imagination. And that brings us to the end of all the questions. Cecilia, thank you very much. It's been a great talk, lots to think about, and I'm sure all the women divers and female divers out there can take a lot from the discussion. If you'd like to ask more questions, or you have additional questions that you think about after the webinar, you can make use of the email address I put into the chat box, but I'll just tell you what it is. It's danmedic@dansa.org, and you can ask all your questions. So it's time for that lucky draw now. We still got pretty much 95% of all the attendees that joined. So if you guys just bear with me, let me just pop all the names into that random picker that I've got. And just to confirm, what's it, 40 winners, Amanda, or is it 4 winners? Okay, 4 lucky winners. There we go. So just hang tight. Let me pull those names. All right, so forgive me if I pronounce some of the surnames incorrectly, but I've got Alex Kusharski, Michelle Brickle, Hillary Jenkins, and Travis Young. You guys have all won the lucky draw gift vouchers from Adventure Mania. I'll be in touch with you guys tomorrow, and I'll include Amanda in the correspondence so we can make sure that you get your prizes. Let me just make a screenshot of those names, if you bear with me just for a seckie. All right. Okay, I've got that. So I think that kind of brings us to the end of the webinar. Thank you very much for Cecilia. Great talk. Amanda, thank you for being our sponsor. Before we say cheers to everybody, Cecilia, would you like to close off with a couple of words?
Yes, thanks, Morne. I just want to say thank you to everybody that has signed into the webinar. Without you guys, what we do, and actually our passion for diving medicine and for divers would be not of any value. And yeah, safe diving, keep safe out there. Remember, we're always available for your questions. Doesn't matter if you think it's never a silly question, no question is ever silly. We also learn it daily. The diving environments is such a interesting, beautiful environment. Physiology around diving. I mean, in medicine, we learn something new every day about the human physiology. So, you know, and just putting that together with the diving environment is always also nice for us and to keep us on our feet. Thanks for joining. Enjoy level 2. Go out, dive with everyone, and keep safe out there.
Perfect. Thank you very much, Cecilia. Amanda, some closing words from your side?
Yeah, thank you, Cecilia. A lot of the questions, or a lot of the information that you gave us tonight are questions that we get on a regular basis. As female instructors as well, what happens is you often get, even though perhaps they have a male instructor or, you know, a youngish instructor or an older, but if it's they usually in any case would turn to me or turn to one of our female instructors and ask us these kinds of questions. So, and that's good. And also for people who are a bit shy to ask some of the questions, this has been absolutely amazing. I've got fantastic feedback. My phone is doing its thing again with all our diver friends. And they're loving it, and I think that it's been incredibly useful. And I hope I'm going to retain all that information, so when the questions come up, I remember the answers. But I'll give you a call. Thank you.
You don't need to get hold of me.
I do. So Yeah, thanks. Invaluable information. And I can't wait to share this a little bit more. The replay will benefit so many more people as well. Thank you. Thanks, Monet, very much for this. It's been amazing. Absolutely amazing.
Yeah, thank you both. It's great. And I'd also like to thank all the folks that joined us this evening. I hope you enjoyed it. If you have any additional questions or feedback, please let us know. Just remember, as Amanda said, the replay will be available via the Facebook or the Dan Southern Africa Facebook page, also our YouTube channel. So I'll get that up and running. And you can expect a follow-up email tomorrow that'll include the link, but there'll also be a range of Dan freebies in the form of the Alert Diver, our annual dive report, access to some of the courses we have. And at the same time, I'll include all these links that talk about a lot of the topics that Cecilia mentioned over the course of the evening. So that's all good. I'm sorry to the Facebook folks. I had some technical difficulties there too. I don't think it's Facebook. I don't think it's Zoom. I think it's something on my end. So I'll fix that to avoid those kind of issues going forward. And if you have any questions, remember, use the Dan Medic at dansa.org to ask your medical questions. That's it from me. Thank you for joining. Have a lovely evening. Catch you next time. Cheers.